Taylor was still feeling pretty good at that time, and
Well, we were excited. It was the day that I believed we were going to be told
yeah, this
It
was
worked.
and that was in the clinic, and instead of being in the one of the regular little bed sections with just the curtains, they said, "Oh, we're having this room today," and okay, and brought us in, and yeah, it was everyone in that room was a major meltdown. Everybody.
Yeah, including the doctor.
And she said she couldn't believe it. She went back 2 or 3, 4 times to make sure they had the right person, the right results from the right person. It was just devastating. Yeah.
Taylor actually asked her first. I think Taylor had a premonition right away.
She says,
And I can't remember exactly what Dr. Shafee said right at the beginning, but Taylor said it didn't work. And then Dr. Shafee broke down and said, no, it didn't. But Taylor knew just before she said it.
yeah.
And I just couldn't even believe what came out of anybody's mouth.
And then once again, Taylor says, well, how long do I have?
Yeah, first thing she said, how long do I have? Didn't even ask anything else. How long do I have?
Dr. Shafee says, maybe 6 months.
They just said, if there's anything you want to do, anywhere you want to go, do it.
Do it.
So,
First thing Tay wanted was
to get a puppy.
A puppy.
I think it's important to be honest. I think, we assume many things just because they're young. Doesn't mean they don't want to hear that they could be dying. They want to know. They ask for it. How much time do I have? What's it going to feel like? I think it's important to let them know that they will die from their disease and that they need to take advantage of the time that they do have to do the things that they want to do, if there's something that they want to do. A lot of patients ask about that. Is there anything else that can be done? Some people are tired and say, no, I'm done. I don't want anything else. I've tried everything and it's made me sick and that's it. It's come back. Others are much interested in learning about their options, and sometimes there are some options. Most of the time they're not curative options, but it might give them some hope, at least for a little while. It might help relieve some of those symptoms I was talking about. So I think that's important to still mention that if they're a candidate. I think I'm a little more emotionally invested when it's a younger person. It's a bigger loss to me. It's hard to say that. You're supposed to like every patient the same. You're not supposed to have favorites or anything. But as I said, I think the ones that are closest to you, the ones that are quite young, who have a lot of life that's going to be lost, it's, I think, trying to get over that kind of loss is really hard, especially because many of these patients, they are suffering with a disease that's not self-inflicted. This is something that came out of the blue, and they've tried everything, and they've bent over backwards doing the things that you've asked them to do, and it still didn't work. It feels like that you failed them in some ways. You sometimes wonder, should I even have put this patient through all this trauma, all the treatment and the stem cell transplant, if they were going to end up to die anyway? To say that you can forget about it when you go home after you've told them that they're going to die, I don't think that's even possible. So you kind of keep your emotions in check as much as you can. Sometimes that doesn't work. I end up crying along with the patients. Definitely with my colleagues when I come back to the office. They know something's up.
I mean,
What do you do? What do you do?
When you're going to tell, no matter who, that news, I mean, it's tough to do. I know. I think, you know. I mean, the doctor was in tears as well. So,
Oh yeah, it affected her too. Huge.
but
She's a wonderful doctor.
but
What
once
was that like, seeing her be so affected by this?
Well, I was there when she first came into the hospital to see Taylor. And she was at home, and then they called her to come in. So to see her through that first day to that last day that she had to tell us, you know, I knew she invested a lot of, you know, care, and she had a lot of feelings.
Yeah.
She cared for Taylor.